This is our first CORA Physical Therapy podcast, and I'm Dr. Rick Lehman from St. Louis, Missouri. And with us today is Tyler Kelly, PTA Clinic Manager from Virginia, Ashley McFadden from St. Louis, and James Allison from Athens, Tennessee. And we're going to talk about what everybody wants to hear about tonight, which is COVID or coronavirus. And I'd like to thank Christy Westfall and Brett Kolnick for setting this up. So the subject of the first podcast is what everybody is talking about, what everybody wants to know about. And the guests that we have significant information based on physical therapy, telehealth. And what we want to do is kind of set the stage for telehealth medicine and what CORA can do for telehealth medicine in terms of everybody sheltering in place and everybody pretty much being resistant or trying to be resistant to getting sick. So Tyler, we're going to start with you. There's certainly a huge amount of fear generated nationally from this pandemic. How does training and strengthening help your patients overcome the fear, number one? And how can a focus on rehabilitation and injury at home build confidence and improve health?
Personally, I think focusing on rehabbing an injury or keeping consistent with a PT program is one of the best ways for people to push through a lot of the fear that's circulating right now. Obviously, it'll help the injury that the individual's working on, but staying consistent with the program helps us maintain some sense of normalcy right now when hardly anything kind of seems normal. We have to remember that even though life is all out of whack currently, this coronavirus crisis will end one day, hopefully sooner rather than later. And staying consistent with a PT program will help you get back to 100% so that when this is all over, you can hit the ground running with whatever you're trying to get back to. And I think staying active is just as, if not more beneficial for our mental well-being right now than it is for us physically.
Yeah, I think that's exactly right. I think the mental aspect is very, very important. James, so next question. The number one way to stay healthy is a strong immune system. And what we're finding out is fewer and fewer people who are healthy, who have a strong immune system, are getting the virus. So please give us an outline of how to build your immune system and what can we do to help our immune system given the environment that we're in.
Just to kind of feed off of what Tyler was talking about, the mental health associated with just exercise in general and physical therapy is not just, moving extremities and stretching and getting stronger and everything. It's great for your lungs. It's great for your heart, especially if you're with a good PT that's going to keep you active and just keeping lungs and heart healthy. Keep your lungs going through their full capacity, getting your heart rate up, keeping it strong. A lot of people don't realize, the heart is a muscle and it's one of the strongest we have in our body. So keeping that, beaten like it should be and using general guidelines of, 150 minutes of moderate activity a week or 75 vigorous activity is just one part of it. If we're talking about, supplementation or anything like that, I typically will encourage people, just make sure you have your yearly physicals and follow us with your PCPs. Make sure you're not deficient in any way, but, general recommendations. I think zinc is a good thing right now with this virus. It's being used to treat it, and there's research showing that it can even be used to help prevent it. So just some things to consider.
No, I think that's good. I think zinc is a good answer to help your immune system. I think colloidal silver is a good answer, and I think some people are showing vitamin C is a good answer as well. So Tyler, please discuss the safety needs in going to physical therapy. What should the patient do to be safe? What should the physical therapy facility do to be safe? And what should the physical therapist do to be safe for patients that are still going to PT facilities? When can they expect the PT facilities to open up and be 100% safe like they were 3 months ago?
I mean, one of the things they can expect to come in is that every clinic is going to be following CDC guidelines on sanitation and safety for the patients. I know for our company, CORA, we've put into place extensive protocols and policies. I mean, just to give a couple examples, all employees are monitoring for signs and symptoms with themselves and are taking temperatures daily before they're allowed to come in. We screen patients at every visit, not just the first visit. and other guidelines as far as cleaning our facilities. I'll be honest with you, I'm not sure I'm ever going to get the smell of Lysol and Pine Sol out of my nose after the past few weeks. But patients should be able to feel to come in and feel pretty relaxed with our environment, and know that we're creating a safe environment for them. And if they have any more information that they would like, they can go to coraphysicaltherapy.com, and at the top of the page is a green ticker. And if they click Learn More, there's a lot more information they can get on what we're doing and some general information about what the coronavirus is.
That's a great answer. Thank you. Ms. Ashley, in patients that are home sheltered, how can they deal with pain, mostly chronic pain or acute pain? And what can they do to avoid narcotics and pain medications that would kind of slow down their progress? And second, and I think this is really important, can telemedicine visits help? And how does a physical therapy patient set up a telemedicine visit?
Okay, there's a lot there, and I'm going to answer it all. Most importantly, the worst thing that a patient can do right now that's having pain, already experiencing pain, is become sedentary. And so we need to get them in the clinic, and it's a matter of if they feel safe coming in our doors and us seeing them in the clinic or through telehealth. If they're sitting at home, their pain's going to get worse. They're going to get tighter muscles. Their muscles are going to atrophy. So we need to find what way they feel best. And research has proven that physical therapy is the key to getting rid of your pain and avoiding the opioids. So to answer your question, physical therapy is the key for pain. And telehealth is a great option that we've never been able to offer before. These patients are going to be, it's a great option for them. And we have so many different platforms that we're using with the patients. If it's Zoom, if it's FaceTime, whatever they feel comfortable with. All insurances are, including Medicare today, came out and are covering telehealth. So first off, we need to find what the patient feels comfortable with. If it's seeing them in the clinic, if it's seeing them through telehealth, and then developing an individualized program for each and every patient. Each patient responds differently, and we need to get them talking on the phone through video conference or in the clinic and individualizing a program just for them. So to set up an appointment, you can call our clinic directly. Each clinic can set you up with an appointment, or you can go on CORA Physical Therapy website, so coraphysicaltherapy.com, and all you have to do is input some information and we'll call you and we can get that set up within 24 hours. So the key is avoiding becoming sedentary, because that just creates more problems and comorbidities, and telehealth is an awesome option that I'm really seeing that patients are loving and responding great to.
That's a good answer.
So I hope that answers everything.
One thing
I wanted to add something to Ashley. I appreciate that answer, Ashley. One of the opportunities that I've had is been able to call patients that are not one that can feel comfortable coming into the clinic, and I've been calling them at their house. One of the reasons why we call weekly is to just check on them, see how they're doing. And really have been very appreciative of just checking on them weekly, not to try to push them to come into therapy, or we offer them telehealth. So that was one of the things that's been a positive, that people appreciate what we're doing as CORA Physical Therapy. But also, I think this negative has made us stronger, and it's hard to believe right now. But when we come back and the country opens up, now we're going to be able to offer telehealth. So there's a lot of times a patient, they can't get in, they don't have a ride, or for whatever reason, the weather, we can immediately just do a telehealth visit right then, and we already know how to do that now before we went off on that. So I think this will make us better once we get to the other side of this.
So Brett, let me ask you this. Is there a prototypical or the best patient, or who are the best patients for telehealth medicine?
Anyone could be a telehealth patient, because we can work on body mechanics. We can work on, sometimes people are doing their work now at home, so we can work on the ergonomic station at home so that they avoid other problems. So we can pretty much do almost anything. We can't do any manual, but we can do a lot of postural work and teach them exercises, and especially ADLs while they're in their home. So things that they have to do, whether they're doing their laundry, whether they're doing dishes, and how they bend over and pick things up, we could work on them as function as we can right there in real life.
And not that we can't do manual with them, but we are able to teach them how to do self-mobilization techniques. So not only are we educating them on posture, body mechanics, but also like when to use heat and ice, appropriate stretching, appropriate strengthening. I mean, there's so much that we can offer through telehealth. And I mean, every patient that I've had that was even questionable about it is like, this is amazing. I love that you can see what impairments I have at home. If it's reaching into the cabinet or doing laundry.
Absolutely, because also it makes us work on our communication skills a lot better, where we might have just taken things for granted, just showing them and move on. We could really speak to them, and also it's going to help us be better clinicians as we move on to this.
I completely agree with what Brett's talking about. Is it shows you how much skill you have as a PT sometimes, being having to be extra creative and improv with certain things. And patients all the time are like, I can't believe you made this so difficult with just my body weight and my couch and cushions. That's kind of part of the fun as well.
And you get to know the patient a little bit more. Patients are talking about their families, they're talking about their job, they're talking about other things, and you get a connection a little bit different and more than you would if you were in the clinic. So it's something that we need to take back to the clinic and connect with our patients even better than we did before.
The next question, James, tell us about what you think the dietary needs are. What do you have to do when you're sheltering in place? And is there any specific dietary things that help rehab rotator cuff tear, knee injury, etc.?
Well, I think first and foremost, you got to stay hydrated. That's a big thing. And I don't think enough of us do drink enough water. And sometimes we don't know how much is enough water, right? General recommendation is just body weight divided by in half, that many in ounces, is what you need to be intaking. Some people that are a lot more active, maybe a little bit more. As far as rehabbing from injury, if it's a inflammation type process, your general NSAIDs over the counter, anything that's prescribed by your physician that did the surgery or PCP. If it's bone injury or any sort, calcium and vitamin D, they can help restore. We already know our bones are made of calcium, so why not ingest some of that and kind of assist in the recovery. And then if it's a rotator cuff tendon, muscle injury, our muscles are made of proteins and water. So again, stay hydrated, take a protein supplement, or just have a good clean diet where you make sure you're ingesting enough proteins.
Perfect. So Ashley, since surgeries are being delayed, what can a patient do to prepare and protect their joint waiting up until the time that they have the surgery? Because one of the things we're seeing now is we think surgeries may come back in May. We don't really know. Maybe they're not going to come back till June. And what can the athlete do who's home, prepare for the surgery, number one, and best be ready for the surgery when the time finally comes that the elective surgery opens up?
I think the best thing that the athlete or individual could do is come in for pre-op for physical therapy. Honestly, our goal would be to maintain the range of motion that they've probably already gained, maintain their strength, minimize their swelling, and just educate them on the surgery to come and the protocol for surgery so they have a better understanding. If it's pain control that they need prior to surgery, but honestly, the more work that they do before, I think it's just gonna improve their outcomes in the future. So if it's coming to therapy in the clinic or through telehealth, I think consistency is the key, and having a physical therapist progress them appropriately so that they don't risk any other injury.
Excellent. So Tyler, quick question. This is important to people who are home, but how much time should they spend, number one, doing their physical therapy a day, and kind of talk a little bit about what a normal time frame is for a telehealth visit, and number two, how much time should they spend doing general exercises during the day in this time of sheltering in place and everybody kind of staying inside, or just walking around outside with limited resources?
I mean, if they're doing their home exercise program or exercises that we've given them as part of their PT or home program, it's honestly going to depend on what the diagnosis is. So like if I have somebody who has a frozen shoulder, I'm probably going to have them working on that for a couple hours a day. But if it's a high school kid who has a recent sprained ankle, I might only have them doing 20 minutes of something a day and then a whole lot of ricing. As far as like the general exercise right now, I typically stick with what the U.S. Department of Health suggests for adults, about 2.5 to 3 hours of moderate intensity activity per week. And then when it comes to my kids, a lot of my high school athletes, I'm suggesting somewhere around 45 minutes to an hour of moderate plus activity a day. The biggest take-home message to try and give my patients who are doing their home programs right now is that they need to keep doing stuff. They need to keep moving. We can't just take this idea of we're stuck in our homes and literally become stuck to our couches and whatnot. You have to keep moving. My clinic is probably more than half of our patients are Medicare patients. So the coronavirus this is a population that this could significantly affect. So most of my patients are home, and I give all of them a little bit of speech, and I tell them, I said, the longer you continue to do things, the longer you will be able to continue to do things. If you rest, you rust. So I just tell people to keep moving. In our clinic above our big window, we have a sign that was made by a previous patient that says movement is medicine. I think people just need to continue getting up and doing some form of movement every day.
I think that's really important, and I think that's an excellent answer. So I'm going to throw this out to everybody. For me, it's important that we have kind of a team approach. And Ashley will tell you, we communicate 2-3 times a week, being here in St. Louis. And I think it's important for the therapist, the OT, the PT, and whoever's on the team to make sure everybody's on the same page and that there's open communication. So I'm going to throw this out to everybody. Tell me about what you guys feel about the team approach and how interacting with your doctors and your therapists, et cetera, makes a difference in patient care.
I think consistent communication is the key. And I mean, we're all in this together. We all want to get the patient back to their optimal level of function. And I think it also, the patients get a different level of confidence for me too, when they know that I'm communicating with Dr. Lehman consistently. So it's very much a team approach, and we're all in it to get them back. And each patient has a different goal, but we're in it to get them back to that goal, if it's lifting a grandkid or if it's golfing or whatever they want to get back to. And perfect example, I just texted you a few hours ago. So, and he responded right away, and the patient they love it.
Tyler?
I think people have to be willing, as providers, we have to be willing to let these other professions come in and kind of help us along the way. I think a lot of times we get too separated and being kind of our own end of the spectrum. But being willing to make those phone calls personally, when you have a doctor physically calling the clinic to talk to you about a patient, I think that goes a long way. And I think it sits really well with the patient when you can tell them, you have a very good relationship with Dr. Lehman. I communicate with him regularly. So what I know, he knows, and so on.
No, I think that's good. Tyler?
I think it's one of the most important things for us as clinicians now when it comes to communications with physicians is keeping the physicians informed of how their and our patients are doing. An example would be, I have a couple kids that are rehabbing ACL repairs right now, and the orthopedic surgeons are only seeing essential follow-up visits. So if these kids aren't going in because they're 12-week follow-ups, not necessarily an essential visit, at least if I'm in communication with the physician who's not getting to see them for 2 or 3 months at a time, the physician's completely in the loop as to what's going on. And that gives our patients, and a lot of the times our athletes, gives their parents some sense of confidence that there is still a chain of communication between all services that their kids and family members are getting.
I think that's excellent. Any more comments, questions, anything we need to add?
What can we do to help you more as team players during this pandemic, as PTs?
Well, I think Tyler's right. I think, we're not seeing as many people. People are very nervous about coming into the clinic, to be honest, and they tell you that, and then they'll call back and say, I don't want to come in for my follow-up. We'll talk on the phone, and I think telemedicine is huge for that. But I think being in the loop therapy-wise, there's nothing worse than having a patient come in, you do a rotator cuff tear, and they come in and they got no motion. The therapist didn't call. You walk in the room and you're like, I don't, holy whatever, you don't have any motion. So for me, if I get a heads up and someone calls and says, hey, you know, we're struggling a little bit with external rotation or inferior glenohumeral glide or whatever, and I have a heads up, at least I can bring that patient in early and do whatever I got to do. So I hate surprises. And I think in this time when when patients correctly don't want to come into a place where there's been a lot of other people who could be sick, I think the physical therapy loop is important. And I think Tyler's point, you know, Brett, that's something that you really want to stress, you know, to your therapist. Hey, give your doctor a call and give him a heads up, because most of these people are a little nervous. And even if it's a telemedicine follow up, just a 2-second email or a text and say, hey, I had a telemedicine visit with so-and-so and these are the issues, or they're doing great, or because all that feedback is just more information and more data points when you see the patient. So I agree. I think that's really important.
You know, on top of that, Rick, also if a patient goes there and something's going on and maybe they shouldn't be where they should be, and they start talking to the doctor about what they're doing or not doing, they can miscommunicate what you're trying to do. And they may seem that they're coming to therapy all the time and the doctor doesn't know, maybe they're not compliant. They need to know that from the therapist. And it's a big heads up, and it gives you, you know, and also builds your relationship and builds your rapport. Rick, I mean, what you and I've been through from the past and how many conversations we had, and also to earn the doctor's respect, but not to be intimidated by the physician. You got to think that you, the PT and the physician, are colleagues. You're on the same level. They're the specialists of doing the surgery, you're the specialists of rehab. And to have that confidence and also bring that to the table and be consistent with that and be accountable for your patient. I think doctors would appreciate that, respect that, and you build in that relationship.
No, I agree with that. And I think that's 100% true. I mean, you could be the best surgeon in the world and it's not going to do you any good, especially in sports medicine, if the rehab isn't consistent and you don't get good rehab. So, you know, if everybody is on the same playing field and on a level playing field. So, and I do think it gives me a lot of confidence to have a relationship with the therapist, so they feel like they can text or call, and, you know, they may have a question, or it may just be a heads up. I saw so-and-so today, and, you know, they got full flexion or whatever. And I think the patients really feel more comfortable when there's a relation, when they know that the therapist and the doctor, you know, are kind of one-on-one and just pulling in the same direction. So I agree with that. We want to make this as informative as possible. I also think for patients, you know, that are going to therapy, to listen to some of this and really understand that we are really trying hard in this time when things are really screwed up to get them well, and we really do care about them, will also go a long way. So like I said, thanks everybody.